time to break it open and really stand out. It's here.
Mainland 98.3 FM, the sound of Lagos.
Are you looking to gain enlightenment on the health and safety of mothers and children? Are you willing to participate in the sensitization effort regarding the well-being of women and children? To discover the power of a nurturing touch, the wonders of a proper diet, the importance of affordable health care, and the truth behind popular myths, tune in to Mother and Child on Mainland 98.3 FM, where we explore the roadmap to achieving the highest attainable standard of health for all women and children. Join our medical experts as they share their insights on maternal health, congenital anomalies, prenatal care, vaccinations, and gender-specific diseases. Tune in to Mother and Child every Monday from 10 a.m. on Mainland 98.3 FM as we play our part in the grand strategy of ensuring optimal reproductive health in our polity. Mother and Child, the show for unrivaled health conversations on Mainland 98.3 FM.
Good morning and welcome once again. This is still the Morning Express on Mainland 98.3 FM. I am Sage Babalola. We've spent the better part of the morning together, but this is about the final segment of the Morning Express for today, because right after this we have the Launch Cafe crew joining us, but we need to have important conversations, especially about health. It's a Monday, and what is the best time to talk about how to protect yourself if not at the start of the week? Although this is a specialized health program for women and children. We're prioritizing them on Mondays, but we do talk about other health issues as it pertains to the general public on Fridays. But for today, let's talk women and children. And in fact, we're focusing majorly on women as we're talking about the subject matter, Polycystic Ovary Syndrome. That's what we're bringing to the decks. It's a condition that affects millions of women worldwide, but sometimes, in fact, most of the time, it goes undiagnosed. It's still misunderstood. Polycystic Ovary Syndrome, PCOS. That's what most of you know is as PCOS, and it affects 1 in 10 women of childbearing age. Let me tell you what the World Health Organization estimates PCOS is, or well, how many people it affects. At least 116 million women worldwide, and this was as far back as 2010. We don't have recent statistics on how many people or how many women are being affected by PCOS. So let's talk about the cause, the signs and symptoms, the risk factors, how it manifests in women, what the complications are, the treatment and management, and the support we can offer to these women. Well, joining me for this conversation this morning, we have Dr. David Edekpolo, who's a consultant obstetrician and a gynecologist. He was with us sometime 2 weeks ago thereabout, and he joins us again for this conversation. Good morning, doctor. Nice to have you.
Good morning. Thank you very much. And I want to thank you again and your management for the great job you are doing to educate women around the globe. Thank you very much for the excellent job.
Thank you so very much. I was really looking forward to seeing you today, but it's okay. I understand that emergency comes up. There will be many chances in the future. So let's talk about it. PCOS. Describe to us what this condition is, first of all, doctor.
Thank you very much. Now, like you rightly said and captured in your introduction, Polycystic Ovary Syndrome, or PCOS, is a condition that is often misdiagnosed and often misunderstood by people around the world. So welcome to this great program from wherever you are listening to us from around the world. Now today I will try to explain, I will mention some terms that are medical, and I will try to break it down so that we can be able to understand it. Now, what is Polycystic Ovary Syndrome? Now, Polycystic Ovary Syndrome, PCOS, is a common condition that affects how a woman's ovaries work. Polycystic Ovarian Syndrome or Polycystic Ovary Syndrome is a common condition that affects how a woman's ovary work. Now, because of the fact that Polycystic Ovary Syndrome is a heterogeneous condition, in other words, it's a diverse condition. It's a condition made up of different things. So many people tend not to understand it. and it's to miss on the diagnosis because it's a heterogeneous condition. What do I mean by that? I mean that it's a different in kind. The symptoms are diverse. They are varied. They have the similar elements or constituents. Now, it's opposite to homogeneous because the symptoms are different. Even in the same human being, the same woman, the symptoms are different. Now, polycystic ovarian syndrome is an endocrine disorder and a common cause of infertility in women. Now, in polycystic ovary syndrome, hormones that affect the reproductive system are abnormal, thereby leading to irregular or absent ovulation. By ovulation, we mean no release of egg. So, in polycystic ovary syndrome, hormones that affect the reproductive system are abnormal. They lead to irregular or absent ovulation. And like we already said, polycystic ovary syndrome is a common disorder that affects up to 10% of women. In other words, 1 in 10 women have polycystic ovarian syndrome. Now, women with polycystic ovarian syndrome, they often have what we call polycystic ovaries. They have polycystic, many ovaries, polycystic. Now, what is polycystic ovary? This means that the ovaries have many tiny, benign, and painless cysts. The ovaries in a polycystic ovary woman have many tiny, benign, and painless cysts. And when you do an ultrasound examination, the tiny cysts will look like a string of hairs, like the beads that women wear on their neck. So that's what we see on a scan. And again, a common finding with women with polycystic ovary syndrome is abnormally high level of androgen. Now, androgen are male hormones, while estrogen are female hormones. In polycystic ovary syndrome, there's abnormal high levels of androgens, and androgens are male hormones. Now, while androgens are found in both men and women, they are considered to be primarily male hormones. So, because of the high androgen levels, which are the male hormones, this group of women have some distressing symptoms like abnormal hair growth, like in the one in the women. They have acne and oily skin. Because these androgens are very, very high, they will have abnormal hair growth on the upper lip, on the chin, around the nipple, or even the abdomen. And this is what we call hirsutism. So the three major features, because of this misunderstanding, many years ago, about 22 years ago, there was a consensus meeting that defined how you know a woman that has polycystic ovary syndrome.
Dr.
And
David.
3 criteria were agreed on.
Dr. David, before
and
we...
the decision was, if you have 2 of those criteria, this woman has polycystic ovary syndrome.
Dr. David, can you hear me?
Yeah, I can hear you.
Yes, I'm saying that before we talk about the groupings for polycystic ovary syndrome, would you like to tell us the cause, first of all, before we break down the complex factors that determine that a woman has PCOS? What is usually responsible for this many benign cysts that you say usually erodes the ovary of the woman?
Oh, thank you very much. Thank you very much. Now, just like fibroids, the exact cause of polycystic ovary syndrome is unknown. The exact cause of polycystic ovary syndrome is unknown, but it often runs in families.
Okay.
There has been said that when a woman that has polycystic ovary syndrome, it often runs in families. And it's also related to an abnormal hormone levels in the body, including what we call high level of insulin. Now, insulin is a hormone that controls sugar levels in the body. So, many women with polycystic ovary syndrome, they are resistant to the action of insulin in their body, and thereby they produce a higher level of insulin to overcome this. Now, this contributes to the increased production of male hormones like testosterone and androgen. That's number 1. Then number 2, being overweight or obese also increase the amount of insulin in your body, and this also leads to polycystic ovary syndrome. To recap, yes, that cause of polycystic ovary syndrome is unknown, but it often runs in families. But it is related to abnormal hormones in the body, including high level of insulin.
Right.
And insulin is a hormone that controls our sugar in the body. So when women that have polycystic ovary syndrome, they are resistant to action of insulin in their body, and thereby they produce high level of insulin to overcome this.
Right.
And this contributes to increased production of hormones like testosterone and androgen. And high androgen, which are the main hormone, they are associated with some more distressing symptoms of PCOS, such as acne and abnormal hair growth in women.
Thank you. Thank you very much. So no exact cause, but you've listed the risk factors, what predisposes, a woman to suffer from that condition. Okay, thank you. So tell us the classification that you were about to explain earlier.
Yes, thank you very much. And like I said, because the misunderstanding, not only among the other population, even among medical doctors and consultants.
Right.
So there was a consensus that was reached in 2023 to give a diagnosis criteria. And this consensus includes the presence of 2 out of 3 conditions I will list below. Number 1 is that the woman will have oligo and or anovulation. I will explain it. Oligo and or anovulation. Then number 2, the woman will have some what we call signs of hyperandrogenism. That means the woman will have clinical or biomechanical signs of hyperandrogenism. I will explain them. Then number 3, the woman will have polycystic ovaries. So 1 is oligo or anovulation. Number 2 is clinical and or biochemical signs of hyperandrogenism. And number 3 is polycystic ovary. Now, what is polycystic ovary? Polycystic ovary simply means that the woman will have 12 or more follicles in each ovary that measure between 2 to 9 millimeters and with an increased ovarian volume of more than 10 mils. Let me come again. What is polycystic ovary? Polycystic ovary means that when you do a scan for that woman, you get 12 or more follicles in each ovary. And these follicles will measure 2 to 9 millimeters in diameter. And they have an increased ovarian volume. Now, like I said, what is oligo or anovulation? Ovulation simply means release of egg. So in women that have polycystic ovary, they will not be able to release egg. So they will not be able to ovulate. So they have frequent or no, they will have difficulty pregnant because they have irregular ovulation or no ovulation at all. Then number 2 is that they will have symptoms of hyperandrogenism. What that means is that they will have symptoms that look like man. For example, they will have hair in parts of the body, like upper lip, chin, around the nipple or abdomen, what we call hirsutism. And they also have what we call the male pattern balding. They will be like balded because of the fact that they have PCOS. Then they can also have acne. So these are the things that the woman will have. Thank you very much.
Thank you very much, Dr. David, for that explanation. So we're saying that this classification, does that somewhat speak to the symptoms, the things that we would physically see, or what you just explained is something that only doctors can attain with comprehensive tests? Or are there things that once you see a woman, aside from the acne and the male features, is there anything that one can visibly see that tells a person that, okay, something is wrong, you need to go to the hospital?
Oh, thank you very much for your beautiful question. Now, the issue with polycystic ovarian syndrome is this. Like I said, it's heterogeneous. In other words, the clinical features we see in polycystic ovarian syndrome will be different from one woman to another. And even in the same woman, it will be different at different times, over time. So therefore, most times, some women will have one of these, some women will not have one of these. Now, one of the major things that people with polycystic ovary syndrome will have that they may be overweight. They may be overweight. And of course, some of them will have irregular menstruation. They will not be able to see their period regularly.
Okay.
And when we say a woman has irregular period, what do we mean by that? Now, a woman's period is irregular if the gap between them is less than 41 days or more than 35 days. So if the period can be irregular, she will not be able to ovulate. She may be fat and she may be obese. So, and some cases, she may not even see her period. In fact, polycystic ovary syndrome accounts for over 75% of all women with anovulation, according to Adams et al. So a woman may not be able to see her period at all. A woman will not be able to release egg. You're not able to ovulate. And so those are the signs. One of the reasons why people come to seek help from me, from doctors around the globe, is because they are not able to get pregnant. So when they wait for after 1 year, because they are not ovulating, they are not able to get pregnant, so they seek help. And because PCOS does not present in the same way for all women, sometimes women don't even have symptoms.
They can be asymptomatic.
Yes, symptomatic. Thank you very much. So they never have symptoms. And this is one of the reasons why we tell women that once you are not able to conceive, it's better to see your doctor on time. Don't wait. Because a woman does not need to have all the symptoms to have PCOS. For example, now some women that have PCOS do not have abnormal hair growth. They're not overweight. They don't have acne. They don't have the hair growth around their chin, around their nipple, or on the abdomen. So, but because they don't have PCOS. So that's why your choosing of this topic is highly commendable, and I thank you and the management for choosing this topic. It's misunderstood around the world, and even among medical people, it's misunderstood. So that's why it's good to explain this thing that if a woman, you know that you are having your irregular period, if you are having your irregular menstrual cycle, or even you have recurrent miscarriages, or you have abnormal growth on your upper lip, chin, around the nipple, or on the abdomen, or you have acne, or you have oily skin and hair, and you discover that you are not seeing your period regularly the way you should see. So, and you're not even pregnant. It is very important that you don't wait, don't delay. Go and see your doctor on time. Some people may have all the symptoms, some may not have. So that's why it's important to talk about this topic. Thank you.
Thank you, Dr. David. If you're joining the conversation now, you haven't missed so much, although you've missed the basic part of the conversation. Polycystic Ovary Syndrome, PCOS, is what we're talking about with Dr. David Edokbolo, who is a consultant obstetrician and a gynecologist, and is talking to us about the complexity of PCOS. And it's quite important because, as you've heard the doctor say, it's often misdiagnosed. Some people asymptomatic, which makes it worse because they don't even realize there's a problem for them to seek help. And so we've been able to talk about what it is, what the causes are, although so far no specific cause have been attributed to PCOS, but we've discussed the risk factors, the signs and symptom, and the effect that it has on infertility. Dr. David, what is the complications, or what are the complications often associated with PCOS? I know you've mentioned infertility as one of the blowback from a woman that has PCOS, but if PCOS is left unattended to, what other complications or what other alterations can happen to the body of the woman who has the condition?
Thank you very much. I love your questions are very, very wonderful, and they are brilliant questions. Thank you very, very much. Like you already said, one of the major complications which we cannot gloss over is infertility. Now, we know that in the general population, now a conception is expected to occur in 84% of women within 12 months and 92% within 24 months, according to Videss et al. In 2000. So, we expect that in any woman in the general population, 84% of women to get pregnant if they are having sex with their husband within 12 months and 2% within 24 months. So, but in polycystic ovary syndrome, you see a woman that married for 2 years, 3 years, 4 years, she's not pregnant. Because we know that infertility is defined as the inability to conceive after 1 year of unprotected regular sexual intercourse. The woman is having sexual intercourse as regular with her husband for 2 years, 3 years, 4 years, 5 years. She's unable to get pregnant. So that's one of the complications. She will not be able to have baby. Now, another complication is that the woman will have, irregular or absent menstruation. So she will not be able to see her period regularly. And this worries a lot of women because when the woman does not see her period, she's not happy. She doesn't have that sense of being a woman. The another complication is that women with polycystic ovary syndrome can have recurrent miscarriage. Now, what is recurrent miscarriage? Recurrent miscarriage is when the woman has a death of a fetus before the age of viability, and she has 3 or more consecutive miscarriages before the age of viability. The age of viability in Nigeria is 28 weeks. So when a woman has polycystic ovary syndrome, she may even get pregnant sometimes, but she will have recurrent miscarriage, consecutive loss of pregnancy before the age of 28 weeks. Consecutive, that means she will lose one, lose another one immediately, then another one immediately. If a woman loses one and get pregnant again before you lose another one, that's not recurrent miscarriage. For it to be recurrent miscarriage, it must be consecutive losses. That means she will lose one baby today, Then the next one pregnancy, she will lose another one. The next one, you lose another one. So if the woman has 3 or more of that, she has recurrent miscarriages. So these are the things that the woman will have. To have recurrent miscarriage, to have infertility, not able to get pregnant after 1 year of regular unprotected sexual intercourse, and to have irregular monthly cycle, and to have some things in future, to have things like to have obesity, to be obese. In other words, our body will be fat. To also have things there to the heart. In other words, you also have type 2 diabetes. So PCOS is also associated with an increased risk of developing type 2 diabetes and high cholesterol levels in future. So it's important to diagnose on time so you can correct the type 2 diabetes and prevent high cholesterol levels. So these are the things the woman will have. So in summary, number 1, you may have infertility, to have irregular or absence of ovulation, to have absence of monthly menstrual cycle, to have type 2 diabetes in future, to have high cholesterol in future, and to also have recurrent miscarriages. There's lots of 3 or more consecutive pregnancies. Thank you very much.
So the diabetes is because of the involvement of the insulin, yes? The problem with insulin.
Yes, thank you very much. Very correct.
Oh, okay.
Thank you very much. Yes,
right.
You are very right.
Let's talk about the diagnosis, although you already mentioned that, the presentation of the follicles and also their measurement in diameter is one way to know. But are there other diagnostic procedures that the doctors often engage in to be certain that this is actually PCOS?
Thank you very much. You are a wonderful, I like your wonderful question.
I hope
very
everybody
good.
is hearing this so they can respect me more in this office.
Yes, no, you are doing very well. In fact, I must commend you. But your questions are brilliant. Your questions are incredibly insightful and apt.
Thank you.
In fact, what people look for is what you are asking me, and I thank you for it. You have done your job very well before you came, and I must commend you. And the management commend you for it too. Thank you for this powerful question. Now, when a woman that has PCOS or polycystic ovary syndrome come, how do we diagnose it? How do we diagnose a woman that has polycystic ovary syndrome? Now, one thing we must do is to take a very good history, a comprehensive health history, asking the woman about what is happening to her. In other words, taking a detailed history is an important part of PCOS diagnosis. Taking a detailed history is an important part of PCOS diagnosis. Now, your doctor will want to know about how regular your menstrual cycles are. So they will ask you, do you have regular menstrual cycle, menstrual period? And the doctor will also ask you about unwanted hair growth. Now, we know that the women's hair should grow on the head and on the pubic regions and on the armpit. Then when a woman is having hair on the upper lip, on the chin, around the nipple area, on the abdomen, on the chest, she has acne, and she has like a male pattern bathing, and she has especially oily skin and hair. Then one starts thinking about the fact that the woman could have polycystic ovary syndrome. Now, you may be said that most women are tempted not to measure unwanted hair growth because of an embarrassment. But it is important you tell your doctor this problem if you have it, because that will give them an insight into what a woman has. So, like I said, a detailed history is important to ask questions about how regular your menstrual cycles are. And you'll be asked about any unwanted hair growth in your body. Then after that, after taking a very good history, the next thing is to ask about, to do a thorough physical examination. The woman may be obese, they may be fat, so they may be very big. So that is another thing that women will have. So in medical history, we discuss the menstrual cycle, the weight changes, and the symptoms. The physical examination will check the woman for signs of excess hair growth, for insulin resistance like darkening skin and acne. Then after that, we do what we call a transvaginal examination, a pelvic examination. Now, like we see, when we do the examination, we are looking for the ovaries. We are looking at the ovaries. Now, in transvaginal examination, we see polycystic ovaries. And these polycystic ovaries are ovaries that are 12 or more follicles in each ovary. And they measure between 2 to 9 millimeters and increase ovarian volume. So when we see a woman with 12 or more follicles, all follicles are in the ovary, and that measure between 2 to 9 millimeters in diameter with an increase ovarian volume, they will suspect that this woman has polycystic ovary syndrome. But most importantly, let me repeat this. Most importantly, and this is one of the things I use a lot in my hospital. Now, when you take a blood sample from the woman, now there are 3 hormones we normally measure, or 4. The androgens, insulin, LH, and FSH. LH and FSH are very, very important. LH is luteinizing hormone. Follicle-stimulating hormone is FSH. Now, when you do follicle-stimulating hormone and luteinizing hormone normally go together instead of their range. Follicle-stimulating hormone should be between 2 to 12, while luteinizing hormone should be between 2 to 12. So they should go with each other. But whenever you do LH and FSH, and LH is more than 2 or equal to 2 or more than 2, it means that the woman most likely have polycystic ovary syndrome. What I mean is this: to do FSH and you get 4, and you do LH and you get 12. The 12 over 4 is 3. That means the ratio of the LH over FSH is already more than 2. So it's asking, could this woman have polycystic ovary syndrome? Because the LH and the FSH go together. But when you see LH far higher than FSH, then the woman could have polycystic ovary syndrome. And if the woman tells that she has a normal irregular or absent ovulation, or she has absence of a monthly menstrual cycle, or she has irregular monthly cycle, oligomenorrhea, then that will tell you that this woman could likely have polycystic ovary syndrome. Thank you.
All right, then. Thank you very much, Dr. David. So how do we manage this condition? First of all, seeing as we don't know the cause, is it curable? And if it is not, how do we then manage it?
Thank you very, very much again for this beautiful question. Now, like I said, we don't know the cause of this very important thing that causes problems on women around the world. There's no cure for polycystic ovary syndrome as of now. Whether in UK, anywhere in the world, there's no cure for polycystic ovary syndrome. But the symptoms can be effectively managed. The symptoms can be effectively managed. There's no cure for polycystic ovary syndrome, but the symptoms can be effectively managed. Now, treatment, it is where many people misunderstand it. The treatment of polycystic ovary syndrome is highly personalized, highly individualized to a woman. Because if you bring about 100 women here now, 100 women that have polycystic ovary syndrome, they will not present the same way. They will present in different ways. Some will have some symptoms, some will not have. Some will have this, some will not have. Some will be obese, some will not be obese. Some will be infertile, some will conceive. Some will have regular or absent ovulation, some will have absence of monthly menstrual cycle, and some will not have. So because of that, treatment is highly personalized based on the symptoms and whether or not the woman wants to get pregnant. Let me emphasize this very well. Treatment of polycystic ovary syndrome is highly personalized and is based on symptoms and whether a person wants to get pregnant or not. Now, what is the first line of treatment? And this is very, very important. The first line of treatment is diet, lifestyle modification, or what we call lifestyle changes. And this is very, very important. Why is it important? It has been discovered, according to Clark et al. In 1995, that in obese or overweight women with polycystic ovary syndrome, a loss of 5 to 10% of body weight may be enough to restore reproductive function, 55 to 100% within 6 months. Let me come again. According to Clark et al. In 1995, in obese or overweight women with polycystic ovary syndrome, a loss of 5 to 10% of body weight may be enough to restore reproductive function in 55 to 100% within 6 months. That means that a woman should do regular physical activity, regular exercise is very, very important because when a woman does regular physical activity, this helps the body use insulin more efficiently and aids in weight reduction. So, number one is exercise, exercise, and exercise. That's number one. So, number two, for those that have those that are taking diet, we encourage that people to eat a balanced diet that is low in refined carbohydrates and sugar. Because if not, because it can help to manage insulin resistance. So they should not be eating too much of refined carbohydrates and sugars. So women that have polycystic ovary syndrome or that are susceptible to having polycystic ovary syndrome, they should eat a balanced diet that is low in refined carbohydrates and sugar, because this will help to manage the insulin resistance that is seen in polycystic ovary syndrome. The another thing that they can do is that we can do apart from lifestyle changes, diet, exercise, and weight management. Now we encourage women to try and lose weight, because for those overweight, weight loss is one of the most effective ways to restore ovulation, which is release of egg, and to improve hormone levels. So now, apart from lifestyle modification, there are some other medications that we give. Like I said, it will depend on whether the man wants to get pregnant or doesn't want to get pregnant. Now let's take the first one. The woman doesn't want to get pregnant. So number one is that we try to regulate the periods. How do we do that? We regulate the period by giving birth control pills, and that will make the period to be regularized. Now, for those that want to get pregnant, we tend to, since they're not ovulating, they're not producing egg, because for a woman to get pregnant, egg must be released from the ovary. So if egg is released from the ovary, the sperm from the man will come to the vagina, to the cervix, to the uterus, to go and meet the egg in the fallopian tube. When the sperm meets the egg, two of them will meet together. And when they meet together, the process is called fertilization. And when they have fertilization, they will form a zygote. That zygote is called a baby. And that baby will now go and stay in the lining of the womb, what we call the endometrium. So when the woman is not releasing egg, even though the sperm will come, the sperm will not see any egg to fertilize. And if the sperm does not see any egg to fertilize, the woman cannot get pregnant. So the way to manage that is to stimulate ovulation. In other words, to help to release the egg. And there are medications that we use for that, like clomiphene, like letrozole, and other ones that we give to them to help to release the egg, so that when the egg is released, the egg will stay in the fallopian tube, waiting for the sperm to come. And when the sperm comes, the sperm will meet with the egg in a process called fertilization. And when the fertilization, the egg, the zygote or the baby that is formed, the small baby, will now move and stay in the womb to become a big baby that will come out later in the future. So number one, for women that want to get pregnant, we help them to ovulate. We give them drugs that can ovulate them, like clomiphene or letrozole. So it's important to see your doctor for the prescription. The other thing we can do is that we also manage what we call, like I said, the insulin resistance. We give them a drug like metformin to help to manage, the insulin problem. Then you also see a doctor for prescription for that. I'm not allowed to give prescription online. Then the other thing that you might have is that some women will have hair loss, they will have acne, they will have hair growth. So you can also use some creams, some anti-androgen medications or topical anti-androgen that will give to the women to control the acne and to control the hair loss. But in some cases, and for people that have excessive hair, we do what we call laser hair removal or electrolysis. We do something to remove the hair. We remove the hair for them. Then for some women and for some no reason, we do all these things. The woman will not get pregnant. In some cases, we recommend them to do what we call IVF. IVF is in vitro fertilization. In which case, the woman is, you produce the egg outside and then make the egg outside and you now implant the egg in the womb. Then finally, another thing you can also do, which is very used today, we call it laparoscopic ovarian drilling, in which we try to drill the ovary to try and remove the polycystic ovary. But that's not very, very possible now. So to recap quickly, now the treatment of polycystic ovarian syndrome, there is no cure for polycystic ovarian syndrome, but the symptoms can be effectively managed. And treatment is highly individualized based on the symptoms and whether the person wants to get pregnant or not. The first line is the lifestyle changes or lifestyle modification, in which case you must eat balanced diet that is low in refined carbohydrates and sugar, and it can help to manage the insulin resistance. The other one is that you want to have regular physical activity. And this will help the body produce insulin more efficiently, and this will aid in weight management. Then you can also do some weight loss mechanism to restore ovulation and improve hormone levels. Then after that, the medication will include one, if you don't want to get pregnant, we give them birth control pills to make them to have regular menstrual periods. Then for women that want to get pregnant, we try to stimulate production of egg, what we call ovulation. We stimulate what we call ovulation induction. So we induce ovulation, we produce egg for the woman. So the sperm can come and meet the egg and fertilize the egg and produce a baby. And the medication we give there are clomiphene or letrozole. I won't give the dose here. Then for managing insulin resistance, we give metformin. And this is a very good medication we use to manage insulin resistance. And for people that have hair growth or hair loss, we give anti-estrogen medication. And for women that have excessive hair growth, we can use laser hair remover or electrolysis to remove it. And in some cases, we can do some manual procedure for the woman called laparoscopic ovarian drilling. Laparoscopic ovarian drilling can sometimes trigger ovulation, but this is rarely used today. Thank you very much.
Well, Dr. David, as we round off the conversation on PCOS, we've spoken about the science of it all. Let's finally talk about the kind of support that we can offer to these women. You've mentioned infertility is a very sensitive topic, especially in this part of the world. In fact, the womanhood is often tied to how many children you can have. So you understand how difficult the life of a woman who's unable to bear children will be in today's society. So aside from medication and the science and intervention, what sort of support can we provide to these women? Especially, you see a woman that has a beard or has facial hair and we laugh at them. This oftentimes can affect them. So what can we do as a society to help these women as they go through their treatment for PCOS?
Thank you very much. Thank you very much. You are such a wonderful interviewer. Your questions are incredibly insightful, up and to the point. Very, very good. Now, like you rightly said, infertility causes great distress to many couples. You know, many couples around the world that are looking for baby are not happy, and nobody will be happy. And we sympathize with them, which is why I really like this kind of discussion. No, so like I said earlier, infertility is the inability, defined as the inability to conceive after 1 year of regular, unprotected sexual intercourse. And like I said before, that in the general population, conception is expected to occur in 84% of women within 12 months and 92% within 24 months. But you see that after 24 months, a lot of women do not have baby. So number one thing we should do is health education, just like the one you are doing now. To educate, that's why I must commend your radio station, I must commend you and your manager and the entire team for organizing this kind of health education program to educate women around the globe about polycystic ovary syndrome. So number one thing to educate people that when you have symptoms, that even if you don't have symptoms, and you discover that after 1 year of regular unprotected sexual intercourse, you're not pregnant. You should seek help on time. Go to your gynecologist and ask questions. Be upfront with the gynecologist. Ask him, why am I not pregnant? I need to be investigated. I need to be diagnosed. So you know that you are having irregular or absent ovulation. You know that you are having absence of you are having period. I mean, you're not your period regularly. You are having regular monthly cycle periods. And you notice that even your periods, when they come, they're not the way you like it. Or you don't even see your period at all. Or you notice that you got pregnant, you had a miscarriage. You have got another one, a miscarriage. Another one, you have a miscarriage. Guys, you have 3 consecutive miscarriages. Then you must see your doctor on time. And one way to do that is to educate, health education like we are doing now. So let people know that when they have chronic miscarriage, that is 3 or more consecutive pregnancy loss before 24 weeks of gestation. That means you must seek help. And if you notice that you have hair on your upper lip, you have beard, you have on your chin, around your nipple, on your chest, on your abdomen, or you have oily skin and hair, or you have male pattern body, you know that you are growing very fast, more than the normal thing. That is the time to seek help. Number one is to educate them. Then number 2 is for support. Whenever a woman comes to the hospital or to seek help, they need all our support, all our full support. It's not good to laugh at them. It's not good to mock them. When they come to see the doctor, that's the time. Not like a woman came to you, has beard, has this. You're supposed to help and encourage her and tell her to do some tests, LH, FSH, androgens, and the rest, so that they can diagnose this polycystic ovary syndrome. The other thing that is very important is that our government is doing very well. They are doing very well, but it will do more. We intend to use our television programs on our newspapers and to educate people, particularly those, and even use some methods like going to the villages where they can do jingles, they can do outreaches to educate women about this issue of polycystic ovary syndrome. Now you can use the imams, you can use the pastors, you can use trade union people, can use the market women association, can use the head of the unit in the rural area to be able to educate our women. They can use pictures, can use photographs to depict the importance of this polycystic ovary syndrome in our villages, in our urban centers, so that women can be able to access healthcare. So they're able to be treated on time. Because by the time most men get bigger, because the older a woman gets, there's declining ovarian function. In other words, the quality and the quantity of the egg decreases as the woman gets older. So which is why it's important for all government organizations, churches, mosques, trade unions, market women to be involved. They should be carried along to be able to educate our people in the villages, in the rural areas, about the importance of polycystic ovary syndrome. Thank you.
Thank you so much, Dr. David. This was a very good conversation. Thank you for your time. Thank you for the wisdom that you've impacted on us today. We know that it's not a one-day conversation. We still have a lot of work to do, especially in Africa, where we seem to be very ignorant about a lot of medical conditions, especially as they affect women. Dr. David Edekpolo is a consultant obstetrician and a gynecologist, and we had a conversation on PCOS. Have a wonderful day, Doctor. Thank you so much for your time once again.
Thank you very much. I really commend your work, your job, as well as the entire team. You are doing a beautiful job. Keep it up.
Thank you so much. Thank you. All right. Well, there you have it. We have to leave the studio now. We've been together for hours, and I know you're tired of hearing my voice. So we're going to have Victor and Rio join us in just a few minutes so that we can move on to the Launch Cafe. I'm sure Victor has a lot of things to tell you, but Rio would open that particular belt with information about what's going on in the business sector, right? Mainland Business Cafe. So as a business person, you should listen to this as somebody who operates within the business landscape in Nigeria. You should know what is happening with Forex, what's going on with the banks, what's going on with the currency, what's our debt profile, what are the new policies as it affects business, especially small, medium enterprises in Nigeria, and even the big organizations, and how it can cascade into the operations of smaller business is something that you should most certainly listen to. Victor would also be here to talk to you about what's going on in Lagos with Mainland Metro. So if you're a Lagosian or you live here and you want to know all the new exciting things that are happening within the state, you should definitely stay with that, as Sunny Danger would be joining him for that discourse as well. And then at 12 noon, I'll be here with the bulletin at noon. My name is Sage Babalola. Thank you so much for your time. Let's step away briefly so we can open the door for more conversations. Stick around.
Fantastic conversation